Welcome again to the Nourish and Flourish podcast series, where we will bring in different health and lifestyle related topics to you in simple and actionable way. I'm Raja Mitra, a technologist from Silicon Valley, California. Today's topic is an overview of sleep. As I was discussing different lifestyle related diseases, I mentioned the four pillars of physical health: medication, diet, sleep, and exercise, in that order. Medication is number one because it is required when a person has already encountered a lifestyle related disease and intervention is better. Then on diet, we had a session 701, diets and supplements. After this session on sleep, we will also be having a session 601, exercise. Then there is a fifth pillar called mental health, which bidirectionally affects the other four pillars. We will have a session 901, mental health, to discuss more on this. So today's session on sleep will be divided in four parts: phases of sleep, how much to sleep, what happens with less sleep, and how to sleep better. Let's talk about phases of sleep. Sleep is not a continuous thing, but a set of 4 to 5 sleep cycles, each about 90 minutes. For each of these 90-minute cycles, there are two sequential phases of sleep: non-REM sleep followed by REM sleep. In REM, or rapid eye movement stage, voluntary muscle activities are inhibited. That is, body is almost paralyzed and dream occurs. In the non-REM stage, you have light sleep sessions and deep sleep sessions. In the deep sleep sections, heartbeat and breathing are at their lowest levels and it is relatively hard to awaken you. Both deep sleep and REM sleep are important. Ideally, each should contribute to about 25% of your sleep time. From what we know, deep sleep allows the body to repair muscle and tissues and strengthens the immune system. REM sleep is crucial for cognitive function, memory consolidation, emotional processing, and overall well-being. How much to sleep? Adults should be sleeping about 7 to 8 hours daily and regularly. When we talk about sleep, it is not the time in bed, but the actual time in sleep. For example, if a person has sleep efficiency of 90%, it means to get effective sleep of 8 hours, the person must be in bed for about 9 hours. Do not pay any attention to claims of superhuman beings consistently sleeping less than 7 hours a day and maintaining good health. When to sleep? Sleep follows the circadian rhythm or body clock. The body clock is controlled by a pack of about 20,000 nerve cells at hypothalamus at brain that make up suprachiasmatic nucleus. Most people would sleep in the night, but you may have noticed that yourself or some of your siblings, friends, or kids are naturally early birds or night owls. This defines the chronotype of a person. It will be unfair to expect all people to naturally fit into a universal clock, like common office hours, because people may have different chronotypes. People with prolonged working hours that does not match the chronotype need to be extra careful as their sleep efficiency is usually poor. In some studies with 18th century Europeans, you may have heard about 2 shifts of sleep in early evening and early morning. While this is interesting, it is not necessarily applicable in modern world. Also, some culture allows and encourages an afternoon siesta. Make sure that such naps do not exceed beyond an hour or two and affect the quality of night sleep. What happens with less sleep? Signs of sleep deprivation in short term can include difficulty concentrating during the day, excessive daytime sleepiness, and forgetfulness or poor memory. Over time, chronic sleep deprivation is linked to health conditions like diabetes, depression, obesity, cardiovascular diseases, and immune system issues. Given that sleep is needed for about 8 hours a day, how to sleep better? There are three vectors to manage the quality of sleep: pre-sleep conditioning, sleep ambience, and sleep aids. Let's talk about pre-sleep conditioning, which includes physical and mental parameters. On the physical side of the pre-sleep conditioning, establish a sleep routine like time to go to bed and wake up. Avoid caffeine, nicotine, alcohol, and exercises close to bedtime. Have the last meal at least 3 hours before sleep. Maybe even go to the bed little hungry. And in the daytime, getting some sunlight exposure to normalize the body clock. On the mental side of pre-sleep conditioning, practice strategies to manage stress like yoga, relaxation, etc. Also be aware of certain medications for anxiety and depression that suppresses REM sleep. Take doctor's advice. Then let's talk about sleep ambience. Sleep in quiet, darkened room. Use an eye mask or appropriate curtains to block out light. Try to have little colder temperature in the bedroom. Ideal temperature for good sleep is 60 to 67 degree Fahrenheit or 15 to 19 degrees centigrade. Warmer temperature affects the quality of sleep more than colder temperature. Leave distractions such as phones and other devices outside the room. Then there are sleep aids. Nowadays you can avail a variety of sleep products like temperature controlled mattresses, sleep friendly pillows, etc. Some people can benefit with a sauna and a bath before sleep. Use sleep trackers like smart watches and Oura rings to measure and control your sleep habits. Test essential micronutrients like magnesium, vitamin D, vitamin B levels that can affect your sleep and adjust your diets and supplements accordingly. Test your sleep quality through your physician. In modern world, there are many cases of sleeping disorder like sleep apnea, insomnia, narcolepsy that are not timely treated. So let's summarize the general guidelines for sleep. Sleep at least 7 to 8 hours a day, regularly, no negotiations here. Chronotype of a person along with ambience and pre-sleep condition determines quality of sleep. Take advantage of technology to measure sleep and supplements to improve the quality of sleep. If you doubt that you are not having good sleep, get tested. With proper diagnosis and treatment along with sleep, the quality of life will improve significantly. This concludes today's session. We will have more podcasts like this to educate ourselves, nourish, and flourish. Stay tuned. A quick disclaimer for medical legal reasons. Any of my notes, comments, suggestions should not be considered as a medical advice or consultation in any form. If you like this podcast, would appreciate you clicking the like button and subscribe to the channel.